Well, good afternoon, Victoria. Thank you for tuning in today. Once again, I remind you that all local information regarding COVID-19 can be found on our website, victoriatxoem.org. For additional questions, you can call our hotline at 361-580-5796. We do have a total active case count of 23 COVID cases today. New were 7, 4 have recovered. As you know, yesterday Judge Zeller and Mayor McCoy announced their stay home, stay safe order that went into effect at midnight. It's effective today. That full order can be found online, once again at the same website, victoriatxoem.org. If you have any other questions about essential businesses, there's also a document on that same webpage that will answer your questions. Today we will have Victoria's Public Health Authority, Dr. John McNeil, and David Gonzalez, Director of the Victoria County Public Health Department, who will discuss updates on COVID-19. I will now turn it over to Dr. McNeil.
Thank you. Thank you very much. Good afternoon, and today we have 11 confirmed cases in one specific facility here in Victoria. We have notified this facility and we are working with him, and I'm about to read a prepared statement concerning that. After that, I'm sure we'll be available to take questions after David speaks. So the Victoria County Public Health Department has identified this facility as an outbreak, and we have a total of 11 cases there. We're watching this situation very closely, and I'd like to read this statement. In an abundance of caution, today I took what we think is a necessary action of issuing an order of control measures to Post-Acute Medical North, located here in Victoria. This order was issued in the interest of public health concerns due to multiple COVID-19 infections involving healthcare workers associated with that facility. I want everyone to know that we have been in contact with the facility on both a national level as well as a local level, and they are cooperating with our efforts. We've also been in touch with the State of Texas Region 8 Health Authority as well as their epidemiology team. They too are genuinely concerned about the public health aspects of this outbreak. Rest assured, all essential steps are being taken to protect not only the patients, but the associated healthcare workers as well. Please understand that these control measures are not being put into place, they are being put into place to protect the public's health, and that both the Victoria County Public Health Department and Post-Acute Medical are working closely together with the same goal. That goal being to identify, isolate, and prevent any further transmission of this virus. It goes without saying that we wish the patients that have been diagnosed positive a speedy recovery. Please know that in the interest of public health, we will continue our policy of being transparent and keeping the public informed. So as far as the update on the specific cases, David will be able to give you that information, and the rest is pretty much stuff that we've already talked about. I'm going to pass it to David, and then we'll be available for any further questions.
Sure. Thank you, Dr. McNeil. Just a few updates on testing and then new case numbers as well. So we're just pulling out latest update on the testing numbers. We're sitting right now at 463 total tests conducted in Victoria County. We currently have 25 tests still pending at this point, and our updated case total is going to be 27 cases in Victoria County. So we've had 7 new cases since yesterday. The good news is we've actually got 4 total cases now recovered. So that would actually bring our active case count back down to 23. So as the coming days, those numbers are going to fluctuate quite a bit, as you'll see some of those patients recover and be taken off that active case list as well as we go along. These numbers came in very late, just a few minutes ago, so I don't have a regional case count at this point. We can definitely add 7. I'm not sure if there's been any additional cases in our region. I usually don't receive those updates till about 4:30 or 5 o'clock this evening, so I don't want to give inaccurate numbers on that point, but we'll have those available tomorrow, I'm sure. Just a quick update on the epidemiological investigations and tracing. Those are ongoing as we get more cases in. It really pushes us to capacity on the epidemiology team. So keep in mind, we're reaching out to those folks as soon as we can, namely those high-risk contacts that we've identified, and going down the list like we've talked about in days before, and really getting that info out to those medium risk and then finally the low-risk contacts. And then if we identify any locations that we need to make a press release regarding on the low-risk side, we'll definitely push those out in a timely manner. But just keep in mind, updates to actual case numbers come in throughout the day, so we try to get a coordinated effort to release those numbers, and we're doing the best we can, and that staff is working as hard as they can to get those numbers out. But primarily, the main focus is that investigation and getting those close contacts notified, so that really is the focus right now. Other than that, really didn't have a whole lot to update today. Ashley, I'll turn it back over to you.
Sure. So once again, that is 23 active confirmed COVID-19 cases in Victoria County, 7 of which were new today. So now we will open it up for questions.
Yes, I had a question. Our 11 confirmed cases with this outbreak, are those included in our prior total of 23/27?
That's a good question. I'll turn it over to David.
Yes, those will be with. I think we may have had 2 new ones from that. I don't know the exact number, but those are included in the cumulative counts. Yes, John.
So I guess we've just recently determined that these previous cases were associated with this outbreak then?
That was all part of. Sorry, the question was if these previous cases were deemed, I guess, as part of the outbreak. Was that kind of what you're getting at?
Right.
Yep. So yesterday, kind of the investigation was ongoing, and that's when the links were being made. So it's part of that process we see, and that's sometimes they take a little longer than others, depending on how many contacts they had between work and out in public. So we're trying to make those links as we go.
And with regard to this outbreak, any idea how this happened? And is there any indication about whether proper protective procedures were or were not being taken there?
You know, we have already started all our epidemiological tracing and the contact tracing, and that's being very extensive. We would love to be able to tell you that we could trace it back to patient 0 or this one person that inadvertently brought this disease there. But we really haven't gotten to that point yet. We're looking at a lot of different issues. There are several patients, and you know, people go different places, so it's hard to say. But as far as I can address this, as far as we can see, the personnel out there have been performing well. They have had their personal protective equipment on. They've been very cooperative in helping us with this. The state is now involved. It's an ongoing investigation, but I cannot really, and I can honestly say that I have not seen anything that they've done that would be a cause for this, other than being a healthcare facility. And unfortunately, this does happen in healthcare facilities because that's where sick people go.
Do you think we will be able to find out how this happened, how this outbreak happened?
The question was, do you think we will be able to find out how this outbreak happened?
Well, that's a great question. We would love to be able to find that out. I'm not sure that we will. I think that we'll have some pretty good ideas when it's all said and done. The most important thing that we're putting our issue now is identifying everyone that we can that is sick and isolating them and getting them away from other people so that the disease does not further transmit.
What exactly is a post-acute treatment facility, and what sort of patients were being treated here?
They have a combination of a rehab and a long-term acute care facility. I don't really want to speak to what their business is, but they do take care of what we call LTAC, or long-term acute care patients, as well as rehabilitation patients. So a lot of these patients do have a lot of comorbidities, so of course it is something that we are taking very seriously. And I can tell you that at this point, thank God, we have no confirmed patient cases.
Can you tell us how these staff members are doing who were found infected there?
The question was, can you tell us how these staff members who were found to be infected at the facility are doing?
I think that there's a wide range of that. Some of them are doing very well, and I think that there is one of them that is critically ill.
Any other questions? Sure.
So I have a few questions. Still getting comments about has there been any updates on if we can get it twice? So I know I asked that yesterday, but we're still getting comments and questions about it, so I figured it'd be worth another ask, Dr.
So the same question for Dr. McNeil today was addressed apparently yesterday, is can you get COVID-19 twice or multiple times?
And that is a good question, because certainly as a healthcare worker, we would like to know that we have immunity from this disease. In other words, we couldn't catch it. There's a lot of factors that go into that as far as all the immunological changes that happen. But for the most part, right now we just don't know. And we didn't know yesterday either, so she was shaking her head. But what we are trying to do, I mean, that's active research going on. We suspect, based on other coronaviruses, that a person will develop an acquired immunity, but right now we just don't have that because this has been somewhat of a different organism. So that research is ongoing, and I'm actually very interested in it myself, and I will certainly let y'all know when that comes out.
And I have another question. I've been reading that China is experiencing a second wave already in Hong Kong. So do you think that something like that could be possible here after we get through this first wave?
So apparently she's hearing about China having a second wave in Hong Kong. Is that possible here?
You know, as far as the term second wave, I can see that what they're talking about, but it's the same disease. So I think that there can be a resurgence of the disease. I think that's a better way of putting it, a resurgence of the same disease. So if you let your guard down, the virus is going to transmit further. And that's why we've been very careful with this. And I can promise you that we're going to take that into consideration, because once this thing starts to die down, and it will, we certainly don't want it coming back. And then there's the question of if it's going to be seasonal. We don't even know if this is going to come back and reappear next flu season. It's hard to know.
If you're a current patient at post-acute, what's your alternative now?
If you're a current patient at post-acute, what is your alternative now?
Well, the alternative is to continue the care that you're getting. And basically what we're going to do is we're going to test everyone in that facility. So we'll have answers to that. And based on those answers, then we'll come up with a plan. The most important plan is to take care of sick people, of course, and post-acute medical understands that, and they do a good job of it. So what we're going to try and do is basically isolate these patients and do what we would do with any other person that's COVID positive, with the idea that we can always treat their acute care needs.
Is it likely that we will discover additional people infected associated with this outbreak?
The question was, is it likely that we'll discover additional COVID-confirmed cases with this outbreak?
That goes back to the old prepare for the worst and hope for the best. We are hoping that we have no further people out there that are infected, but pretty much with everything else, the more things you look for, the more things you find. So with the increased testing that we're doing, it would not be surprising to find other patients.
Any idea about how long, what periods of time there was an exposure risk at this facility, and what sort of exposure risk would you classify that as?
Well, in a healthcare facility like that, I think that would have to be a high risk, David, by definition.
For the most part, yeah.
For the
Yes,
most
sir.
part.
Mhm.
As far as, David, do you want to talk about how long, and that's all part of the contact tracing with the epidemiological studies that are going on. I know that they will look back usually about 14 days.
Mhm.
So 14 days from the onset of the first infection, or before the first infection.
So we have to determine that, yeah.
They really haven't, because as these cases are coming in, they're looking back to see. The biggest question is, we ask them, when did you start to feel sick? And then usually what Brittany tells me is that they go back 48 hours behind that and consider that their first day of sickness.
And with regard to the 7 people that we're reporting today discovered to have the disease, how many of those people are associated with this outbreak? And if you could talk about any of the others who are not associated with the outbreak, how are they believed to have caught the disease, and what kinds of people are those people?
Yeah, so the question was regarding the new cases that they're associated with the outbreak, and then also the ones previously reported. John, were you asking specifically about like transmission methods on those?
Right.
Yep. So the new 7, the information I actually just got right before we walked in here, and we just got raw numbers. So unfortunately, I don't have more detailed demographics or actually transmission methods on the new cases. What we are discovering still, as far as we determine, and we had the 4 previous that were determined suspected community transmission. At that time, at yesterday's reports, we had close to, I believe, 8, I believe, maybe, that have been travel related. And then there's some still that are under investigation. This will add to the more of the investigative side. And unfortunately, I wish we had that information as we come in here. And it's so hard to prioritize. Obviously our priority right now is to really make sure we reduce future risk and contacts with the community. And then they'll provide that information back that we can communicate with y'all. Ideally those high risk contacts, as we stated before, are really going to be reached out very soon into this investigative process. So they'll be contacted directly from the health department and epidemiological team. And then as we go along, we'll discover more medium and low risk contacts and then provide that information back to you all.
Can you also tell us about how many people are working with that epidemiological team? What sort of people, and whether or not you think we need more investigators with that team?
That's a good question. John had asked as far as how many, how many folks are actually working on that team right now, and some kind of what the I guess professional background of those folks are. Right now, initially, is our head epidemiologist. Epidemiology is a profession where there's really not a whole lot of them out there across the state, across the country. We're lucky enough to have one here. She's very good. She's brought a team together with our nurses there at the health department. So she's enlisted, I think a total now, we've got about 7 or so working on that team. We've looked at expanding that team if necessary, but it's tough because it's not something that everybody does on a daily basis. So there's a lot of training things that go into it. So she's got a great team there. It's all health department staff at the moment. So we've kind of had to rearrange services there, but they're definitely working day and night to get this under control.
But,
So I have a question asked by a viewer, and it says, what about the people who work right next door to this facility, this post-acute medical facility? Are they at a high risk for contracting this?
By definition, no. This is a disease that's transmitted person to person. We still believe that. There's some discrepancy as far as the distances. We're still going with 6 feet as per CDC standards. But just being in a building next to them does not, it's 0 to low risk.
And I have another question asked by a viewer. For the people who have already recovered from COVID-19, what are their steps moving forward?
So out of those who have recovered from COVID-19, what are their steps moving forward?
Until we're for sure as far as acquired immunity, I would tell them to still practice social distancing, avoid crowds, and pretty much do what everyone else has done. Hopefully next year we'll be able to tell if people have that immunity.
Thank you.
Absolutely.
it sounds like we've ceased some services at this acute care facility, but to be honest, I wasn't quite understanding what the medical terminology meant. I would love to hear a better explanation, I guess, about what is continuing there and what is not continuing, and whether or not there are even patients there now.
So John's question was, what kind of services are continuing at post-acute medical rehabilitation north, and then what type of patients are being serviced there now?
Well, when you look at it, I mean, it's a long-term acute care facility, and these are patients that basically are taken from the hospital and treated there at their facility, and they're usually there, I don't know exactly, but anywhere from 5 to 26 days. And they're basically for continued care that they would receive in the hospital, because it is a hospital. So they get good care, and hopefully they're able to get some rehabilitation and be able to transition back to home or wherever they're going. They have some other outpatient services. I know that they do wound care, and it's my understanding that they've certainly ceased all that for now, which is a good idea, and they were very willing to do that, and in fact they suggested it. So they've been very proactive as well. I've spoken to their CEO. I've spoken to their chief medical officer multiple times. I've spoken to their current medical officer, and that's here in Victoria. They've helped us along with this. We were on the phone with them for a long time today. We're all working together with the same goal, making sure that we can basically stop the spread of this or transmission of this disease.
And I'm not sure if I heard you correctly, but are there still patients being treated there, and is that okay?
There are
still
still
patients being
I'm
treated
sorry.
there was the question.
Yes, there are patients that are still there. There are patients that are still in the facility. And until they're tested, it probably would not be a good thing to move them to another facility. So in the interest of safety and stopping the transmission of this disease, we want those patients tested to make sure they're not COVID positive. And the worst thing that we would like to have happen is for them to be transferred to multiple other facilities, because then we're just aiding in the transmission of this disease.
By the way, what is an outbreak exactly?
The question was, can you define an outbreak?
So defined in a healthcare facility such as this, an outbreak would be 3 or more cases in one facility, basically is what it comes down to.
Have we had any other outbreaks discovered in the county?
Have we had any other outbreaks discovered in Victoria County?
No, that's not.
I have a question. So as for the critical patient you mentioned yesterday, Dr. McNeil, how are they doing? If you can give anything to that, and have we added more critical patients?
That is the only patient, the only COVID patient that we have right now that's considered in critical condition. I actually spoke to her physician today, and without violating any HIPAA things, she is critical but stable.
Wondering if this discovery of this outbreak is changing the direction of our epidemiological investigations, as well as any directives or guidance to the medical facilities here.
David, you want to say?
So, sure. The question was if the recent identified outbreak was changing, I guess, recommendations of the healthcare facilities and our approach in general. And I would say at this time, no. We definitely we're honing in. We're focusing on that facility right now to get them the resources they need to handle this outbreak, and they've been great partners in working with us to do that. But we're also, as far as our approach to general public and other healthcare facilities is pretty much the same. You know, we're doing everything we can, suggestions to prevent further infections and the spread of the illness moving forward. And we're pretty much at the point we need to be at as far as guidelines and restrictions go.
And if it's discovered that, I know you said before that it looks like the facility was doing the proper procedures, but if it is discovered that they weren't taking proper safety procedures, could there be penalties?
I'll repeat the question, then we'll kind of go back and forth on it. The question as far as if it was deemed that they were not practicing proper procedures, if there would be some sort of penalty later on. I really don't want to speak on legalities and the penalties because I'm not 100% sure on that. I would defer that to legal and also to state to determine that.
But fortunately, that has not been the case. I mean,
Yeah, right.
they've been very cooperative.
Yes, thank you.
Any other questions? We have time for maybe two more.
Has anyone been fined or jailed so far for not complying with a COVID-19 order?
The question was, has anyone been fined or jailed for not complying to the COVID-19 order?
No.
Not that we're
Not
aware
that we're
of.
aware
no.
of, yeah.
No.
But the day is young, so.
Were there any other questions?
One more.
Sure.
For non-essential businesses, could you give any more guidance? I feel like we might have already talked about this, but any more guidance about or advice about how to keep distance between customers, people?
Well, the question was if we could provide any more guidance for essential businesses as far as social distancing practices. And once again, that's going to be directed to the local orders that our mayor and judge put into place, which is on our website, victoriatxoem.org. And once again, social distancing enforces the 6 feet distance and, of course, the limitation of public gatherings of 10 or more. With businesses, we, again, like the judge said, we wish everyone would be like HEB, but that's going to be up to the business owner and management. But again, those orders, the stay safe orders are in place, and if you have any additional questions, you can look to our website for that.
And if I could just tack on one more question.
Sure,
Similar
last
to
one.
that, kind of a personal question for me. Say we're outside, and it seems like there are a lot of people who are outside enjoying the weather. Wondering if you think it's safe to pass by someone in close proximity, say on the sidewalk or on a path.
The question was, is it safe to pass by someone occasionally on the sidewalk? Let's say maybe you're jogging outside in the park or something like that. Dr. McNeil?
We certainly encourage social distancing, but there's no evidence that this is transmitted through casual contact like that.
All right. Well, if that's all, I will close it out. Thank you all for being here. Thank you for your questions. Thank you all for viewing online. Thank you, Dr. McNeil and David and Karen, for interpreting. For accurate information, once again, directly from your local officials, including that order that John was asking about, you can visit victoriatxoem.org. You can call our hotline at 361-580-5796, weekdays, 8 a.m. to noon, and then 1 to 5 p.m. Today's press briefing will air on local Suddenlink channels 15 and 115 at 9 p.m. tonight, and on local radio stations Kix, Q92, Jack FM, and Club. For anyone with unmet needs, please call 211. Texas Health and Human Services also has established a 24/7 statewide mental health support line, and that number is 833-986-1919. Once again, as David and I had stated earlier, the release of these confirmed cases is at 23. Those are active confirmed cases. We want to begin announcing those at 5 p.m. daily, and so that's just to not exacerbate our epidemiological team and their focus being on the investigations. Last, I want to remind you that yesterday was Census Day, and you still can respond to the 2020 census by visiting my2020census.gov. The census impacts how our city receives federal funding to support many areas of infrastructure. Remember that everyone who lives in Victoria counts. Thank you all for your time, and we'll see you here, same time, same place, tomorrow at 3 p.m. Thanks.